Welcome back to another episode of Practice Underwater. We've got a nice change of pace as an episode today. We have a dentist who is very squarely a solo dentist on today with Suzanne. And so this is an interview that I think is really cool. A lot of stuff gets highlighted. Matt, do you have any initial thoughts before we head to the interview?
It's nice to see a solo on here. Been inundated with your group people,
My group people?
your group people. I think you inspired a generation of people who are aspiring to be group owners. I think it's really refreshing. A true solo back on the show. Let's get some solo on here.
He'll say it in the interview, but he's pretty adamant on the fact that he wants to be a solo dentist. And just talking to him, he has the personality that I typically associate with somebody who wants, not everyone, but like this is kind of the very sort of stereotype solo dentist right here. And I want to just add some information as context for this guy's practice, just to paint it. And so we're looking here at his dental intel. He's got roughly 600 patients in his practice. Office size, it's roughly 500K. And he's got about 3 ops with 1 hygienist working 3 days a week. So just kind of paint the picture. You'll see that at the beginning, but just kind of give you an idea of the size office that he has. It's kind of like a smaller to mid-size solo dentist office. So, yeah. And so we'll talk more in the outro, but for now, we'll just go ahead straight to the interview.
Hey, gang. Welcome to another episode of Practice Underwater. This is Suzanne, and I'm here with our guest, whose fake name is Eddie. Welcome, Eddie.
Hi, thanks for having me.
Thanks for being our guest today. How's it going?
Not too bad. Can't complain.
Good. Well, I'm going to get everybody giggling here. When we, kind of recorded this morning, we said something like, how's it going? And you said, hey, I'm technically on vacation, but I'm at the office. So how does that sound to everybody, right? On vacation, but I'm at the office.
I'm sure there's people out there who can relate. It's hard to leave it behind sometimes.
Okay, we may bring that up again in our conversation later. All right, so let's start off. Let's kind of dive in and tell me and the audience about your practice.
Sure. A little bit about me. I was working in an associate position for a while, and I wasn't really happy doing that because I couldn't do clinical dentistry the way that I wanted to, which was challenging for me. Just getting out of school, not having the pace that I wanted to, but also not being able to hold myself to a high standard. So I started to figure out that I wanted to buy a practice. I wasn't really looking, but I knew I wanted to go to a situation where I could buy the practice eventually. I started working at another practice for a day a week. I met an assistant, and she introduced me to the owner of the practice I eventually bought. And he basically said, I'm ready to retire. I have a small practice. Is this something you'd like to do? So I just kind of took the leap of faith and bought the practice. Really old school type of practice. Crown and bridge. He did some perio stuff, a little bit of implant stuff here and there, working 3 days a week, not many employees, pretty low overhead though, but not a lot of technology, and needed some work done to the practice in terms of the office and some of the equipment. And yeah, a really good patient base. I retained quite a few of the patients. I think the last I checked, although it's been 3 years now, we were close to 95% retention through the transition, which was pretty good. Most of the people I lost were people who went back to, they traveled a long way to come to see him, and they just decided they wanted to find someone closer. So yeah, I do a lot of crown and bridge in my practice. I don't do as much perio. I do some implant surgery. I've done a bunch of training on that. I do a lot of, oddly enough, I do a lot of larger cases. I do some cosmetics and things like that. So it's basically bread and butter, and then, 1 or 2 large cases a month. And that's kind of how my practice chugs along. I have 3 employees, and occasionally I'll have the previous owner in to do gingival grafting if a patient requests it from him. And I do a little Invisalign, but nothing crazy.
Okay. So practice hours, all of that. Tell
Oh, sure.
me,
Yeah.
what your week looks like.
Yeah, it's 3 days a week. Or if there's something a patient needs, I'll make an appointment on one of the days that we're not there if I have a big case or something like that. But typically it's Tuesday through Thursday, 8:30 to 5:30. Um, and yeah, so it's a little challenging to give you the full picture because of COVID. So things have been a little unusual, especially in 2020, but we're actually pretty much back to where we were in 2021, which is a relief. Um, Hygiene, it was just a crapshoot whether or not people wanted to come in and actually do that. Now hygiene, we're booked out months in advance, which is great. I have one hygienist. Um, Patients absolutely adore her. She's fantastic. Um, I don't know if we're gonna do. Do you want me to talk about goals yet, or do you want to? Do you have any other questions?
No, I tell me about, your long-term vision for the practice.
Yeah, I. It's not. I don't want to grow it into a multi-million dollar practice. I do like the sort of few days a week. I'd like to go up to 4 days a week. I don't really want to have an associate. A lot of people I know want to grow it to where they can offload it, but I like doing the dentistry. I just want more patients. I wouldn't mind having another hygienist potentially. I have 3 chairs, and I only work out of one, and the hygienist really only works out of one. So we would have a little bit of leeway in that sense. If I could add a hygienist a day or so here, or move my current hygienist to 4 days a week, that would be really great.
Hmm. Why haven't you opened 4 days a week at this point in time? Like, what is it with the 3 days a week?
It's pretty close. We just don't have the patient flow. If I open another day, I feel as though she wouldn't be very busy. Every day it's like almost like a consolidation thing. We're busy for 3 days, but 4 days would be a stretch in terms of having her be there. Um, I did hire a new practice manager the middle of last year, and her first sort of thing that she did was clean up the AR. We had a lot of outstanding accounts, and so she did a really good job with that. Reformed our billing practices, meaning she actually started sending out bills, which my previous office manager wasn't really doing.
Mhm.
And just the collections and cash flow has been a lot better since that. And she also redid our website. She sort of spearheaded that. And so we've actually been getting many more new patients, but the town I work in is a bedroom community. We don't have a ton of businesses. I'm in a very residential area. It's it's upper class. It's wealthy, which is really nice. But there's a lot of other dentists in the area, so attracting new patients is challenging when there's bigger practices that have specialists, people that have been around a while. It's hard to get my name out there. So that's why I'd like to get more patients in hygiene, because I think that would be beneficial.
Okay, so let's go back to, we'll come back to the patient base in a second. Let's go back to the operatories. So
Sure.
tell me again, you have 3 ops, and you said you work primarily out of one?
I do. Yep.
Okay. So you're doing bread and butter dentistry all in the same operatory?
Yes.
So okay. So are you thinking this is a long-term plan for you to only work in one op and then have hygiene,
No.
or help me understand that?
Yeah, I wouldn't necessarily work out of one operatory long term. I don't feel as though my restorative schedule isn't so crammed that I feel as it's a problem. I think if we truly move to like a packed 4 day a week hygiene type of thing, well, then my operatory would gain 1 day, so to speak. So I'm still not sure it would be packed, but if hygiene grows and my restorative schedule becomes more crammed, more hectic, then yes, I think two chairs, possibly another assistant, would be beneficial. So there's room for that. I actually have first rights at the unit next door to me, so if I needed to expand, totally possible. It's just not something I think about a whole lot because it just seems pretty far away for me. That I could, if I wanted to, expand.
Tell me more about the types of treatment
The seller did more gingival grafting. That's pretty much the only thing that he did that I don't do. I added ortho, some endodontics. We're probably very similar in terms of the crown and bridge that we do in terms of the production in that sense. Yeah, he didn't particularly move very quickly either. So yeah, I think it's a pretty similar practice, save for the gingival surgery. I don't really feel as though I want to get into that. That's not my forte.
So you just have him in there when the need arises, basically. There's no
Yeah,
plan.
or refer to a periodontist. He's slowing down. I think this will probably be the last year that he does anything in the office. It's kind of one of those things. He does it so infrequently that he kind of just doesn't want to do it anymore. So
You want to head in the direction of a lot more comprehensive dentistry?
yes, yeah. I already do a fair amount, and I'm not totally delusional in that I'm going to be able to get every patient to do comprehensive dentistry. But I do talk about it a lot. I do a lot of photography. A lot of my time, honestly, is spent talking and explaining things to the patient, which, given that what I've heard from other dentists is, it's a challenging thing to do, especially if you're really busy. That can take up a lot of your time, and it's not necessarily something that is compensated for always. But I actually think that's probably why a lot of my patients do come to me. I do spend a lot of time with them. So yeah, managing that as I get busier is something that concerns me. I don't know if it would be beneficial to set aside time where I do consults with people or something like that. But yeah, that's a lot of my time is diagnostic wax ups, talking to patients, photographs, talking to people about what we can do, that kind of thing.
So Dental Intel shows about 600 patients as an active patient base. Does that sound about right?
Yeah.
Okay. So just from a scheduling standpoint, if you're doing some of these larger cases, do you feel like the 3 days at this point in time are enough for you to handle those patients?
I would say that that's a difficult question to answer. I would say that some weeks it is and some weeks it isn't. Sometimes it's really swamped, and other times they'll be like, "Oh, we're barely doing anything this week," which is frustrating. But I think that, as far as I know, I don't know how to run it any other way. That's just sort of a reality of how I practice. Some weeks you're going to be running around doing huge cases, and then you're trying to fit in bread and butter dentistry where you can, so that your patients aren't waiting forever. But other weeks, it's just bread and butter, or maybe there's a day that's just kind of like not productive. But that's a challenge that I have, and I know that people are balancing this better than I am. I'm just not sure how. So.
So tell me about the investment. What do you feel like has to be invested, or where do you think the benchmark has to be for you to feel comfortable with being open 4 days?
In terms of investing, I guess.
So I'm trying to get to a sense of what's been sort of your plan in terms of when you get there, when you get financially there, when the patient base is there. Kind of, I'm trying to get a sense of what has been your plan in your mind.
Getting new patients in the door. One of the things that I've worked really hard on is Google reviews for my practice. Especially in the past couple of months, we've gotten up to like 30, and we're trying to get to do about 10 a month now. Now that my office manager has sort of taken that over. So for me, it's all about getting new patients in the door, getting people in hygiene, getting them comfortable with our practice. I mean, that's how I'd like to open 4 days a week. I don't really see there being any other way to do it. You got to have the patients to put in the seats.
hmm So if I look at just those pure numbers, and I know I'm getting in a little bit into some of the weeds in some of our discussion and, part
Okay.
two, but if I just look at 600 patients, what you have in terms of 3 days, if most of those were coming in, that those are the number of hours, 3 days a week is what you need in terms of hygiene to be able to service those patients.
Sure.
So do we have enough options for new patients?
hmm
How far booked out do you feel like your hygienists are at this point in time?
I don't know that right now, but I think we're booking past April. But we also we were doing really well with pre-appointing people, and now we are kind of again, like doing 6 months in advance, making sure they have an appointment in the computer, and then you know, COVID and that sort of all to a degree got thrown out the window. Plus, I got a new practice manager. Um, so I don't have great information for you off the top of my head because we're still a little bit in recovery mode in terms of not sure how reliable the data is of who's booked or how far out in advance we're booking.
Okay. So tell me what you've done so far in terms of marketing. You said the office manager is the one in charge of all of your marketing?
Yes, yeah. Yeah, we've rebuilt the website. We had photographs taken of the whole team and the inside of the office, which actually during COVID I put some of my own money into to renovate a little bit. Painted new floors. We had carpet on the floors. I mean, it was really it was really 1980s esque, and um, just a lot of stuff to show people the inside of our practice. We don't have signage. We're inside of a professional building. So that's a handicap in terms of attracting new patients. But do have really good word of mouth. I've sort of been working on training my team to talk to patients and do some internal marketing. Like, we know you're really happy here. We want more people to see us and to realize, what a great job we do. Would you recommend us to some of your friends or family? We're trying to grow the practice. I'll even tell the staff, tell them we'd like to be open 4 days a week, and we just want to grow our patient base a little bit. And that's worked quite a bit, actually. We're right near a college, and a lot of college students actually have been coming in. I had 2 or 3 college students from the particular college that came and had some work done, and then we got a little bit of a barrage of students from them, and generally families, that sort of thing. I mean, we're in a bedroom community, so it is families. People don't really work here that much, and in terms of, we haven't done any Facebook ads or anything like that. We do have an Instagram. It's professionally run by a service. It's okay. I don't know how many people that's actually attracting. It seems like one of those things that you can't not have it, but I'm not sure how much it's going to do for me. um, and yeah, so mostly internet. I mean, that seems to be how everybody finds their dentist at this point, unless somebody speaks up and says something. So we're kind of going with those 2 channels, word of mouth and internet. But I thought about sending out postcards to new homeowners, but I was just thinking about how I would perceive that and just chuck it in trash. So I just didn't know how effective that would be.
So is your office manager pretty versed in marketing? You said she created a website from scratch?
No. She actually came from another field. She was in teaching, and with COVID, she wanted out of teaching. So I hired her. She's quite a type A person. So we've had meetings all the time about this in terms of, okay, I want you to talk to these web designers and see, which one you think would be the best. Come back to me. We'll talk about it. We'll make a decision together. I gave her kind of a budget of what I wanted to spend, and she sort of went out and did what she could with that budget. I think the website has made a big difference. That in the Google reviews, it really has started to pay dividends in the past couple months. But again, with COVID, I don't know. I don't know if people are also just coming out of their shell a little bit more, and that's why we're getting new patients. So, again, it's really hard to. I'm sure you've had this issue as well. It's hard to determine what data is real and what data is changes in the world.
Well, I'm going to go back to a little bit of a disconnect here. And I guess thanks for clarifying that, because you said the office manager is sort of spearheading things. So I'm assuming that if she's working with a marketing company, you're looking at some of the results of your ads and some of the results of your SEO engagements and things like that. When I look at your website, I see a lot of young people on the website, the beautiful smiles, beautiful, faces. And the disconnect here is just, I'm going to challenge you to think about, are you guys clear on who your target audience is? Because I thought I heard you say, I like to do the clinical side. I like the larger cases. And so from a target audience standpoint, I don't see anybody that's on your website that's of age that would want to do, say, implants or all on fours or things you may want to do that are a little bit more comprehensive, if I can use that word.
Sure.
So tell me a little bit about that.
I hadn't thought about that. To be honest, I haven't been that involved in marketing before, so I don't know a whole lot about it. But I did make the previous website, which was, basically all you could say about it was that it was there, that it existed, and it worked to some degree. It told people that I existed. So I went with, I don't even remember the name of the company, to be honest with you, but they do dental websites, and I think it was some sort of template with stock photos that they use. It's not, I'm sure they could put older folks on there that might be more relatable to the audience, but I didn't consider what message I was sending out, really.
First, clarify, what do I want to do? Who's my target audience? What are the procedures that I want to do? And then who do I want to attract to our office? You mentioned you spend a lot of time talking, taking photos and all of that. That's the niche environment that you'd like to work in. How clear is everyone on that message? Briefly, again, before we get into the nitty-gritty and all the numbers, you're taking on a lot. You can delegate so that you can take care of the patient base so that you can grow into 4 days sooner rather than later.
Okay.
Let's tell the audience what you want to get out of our time together.
A more clear path to 4 days a week, and determining what the numbers mean, how I can use that, and just being more informed about the business side of things.
Well, it sounds like we're on the same page with where we're headed in part 2. So I'm going to tell everyone to stay tuned for next week's episode of Practice Underwater, because that's going to be a lot of great stuff we're going to be talking about. Okay.
All right. Awesome. Fabulous.
Matt, we talked about it before the interview, but I hope the audience sort of sees what we see, that if we're looking at the personality of somebody who's a great fit for the solo dentist model, I really feel like Eddie here is somebody that I feel embodies, the qualities of somebody that can sustain happiness as a solo dentist.
Yeah, for sure. Super into clinical dentistry, has taken a lot of advanced CE on it, likes the slower paced office, loves interacting with patients, spending his time and getting to know them and doing really good dentistry, and, a little bit more risk averse, right? Totally a fit for solo. And I'm glad he recognizes that too.
Yeah. And I loved, and this is something that I wish more people spend time on pre-ownership, thinking about, their personality type as a dentist and what they want. And, and like you talked about at the beginning, we romanticize larger businesses on the show, and that's never the intention. It's just, we tend to be people that prefer that because of our personality types. But for a lot of people, this is a much more simple, straightforward, predictable model. And I'm really happy that Eddie kind of got to highlight the personality that is a good fit for this model.
Yeah. And I think it's important to point out that, our shared practices approach is not pigeonholed to one type of office. I know we talk a lot about that, like faster PPO type office and, bigger group, but it works extremely well in this kind of office too, where the doc is super, clinically motivated and cares about relationships with patients. And it can also, lend well to this environment.
I'd like to expand on that, because I actually think it works better in this kind of office. So, just to recap from the episode, he had talked about how much he likes a slower paced model, a bunch more photography, comprehensive treatment per patient. and kind of treating things in a very ideal way, which is his clinical passion. And what happens, so that's all good from the dentist side. I don't want to talk a whole lot about that, but what I want to talk about is how that looks analytically. So when a guy practices like that, their production per patient is usually a much on the higher end, because if they're doing the case acceptance right with all the photography and the financing options and all those different things, then they're able to maximize the revenue per patient. What that allows us to do is to be much more aggressive in both opening up the schedule, which we'll talk about in a minute, and on the side of marketing. So he talks a lot about new patient flow, and he's seeing like roughly 10 to 15 new patients a month right now, according to his dental intel. And it just lends itself to really be a good situation for him. If he can have a very high production per patient, that gives him a lot of ability to take on risk because of his ability to capitalize on each patient financially. And so I think that our strategic risk model of growing a practice works even better when they have higher production per patient, because we can take even more risk without it being bad for the practice. So we can open up that fourth day and really benefit from that, which is, I think Matt and I both want to talk about that fourth day. But Matt, do you have anything to add to that whole concept of, looking at the shared practice philosophy or the analytics-based practice management through the perspective of somebody who wants a slower paced office with more photography and all that?
Yeah, I think in a nutshell, what you're saying is, a doc being extremely advanced clinically and into bigger cases gives us a lot of leeway as far as the cash flow that's available at the end of a month, and you can do a lot of that like he does on very minimal staff members. He bought an office that was probably under 500K producing a year, and he said it had lower overhead, it had good cash flow even then.
Yeah.
So it gives us a lot of flexibility as far as like you said, marketing and adding a provider on another day, adding a hygiene day. It's just more with this doc. It's about mindset work. It's about getting him there where he sees that he's financially able to take those risks and reap the benefits of when he does it.
So can you elaborate on that mindset work? So it's something that in part 2 is going to come up even more. But can you talk about the mindset that you see here with Eddie?
Well, he says, and this is very typical of a practice owner want to interview, right? He says what he wants. He wants to be open 4 days a week. He wants to add another hygiene day. He likes doing a lot of complex dentistry. But where he's, getting tripped up is taking the necessary action to actually make that happen. Like, it's one thing to have a goal. It's another thing to be moving towards it. And a lot of that involved in that is upping his marketing budget, his marketing spend, which, from all the looks of it, it's very minimal at this point. So that's a mindset shift, right? He's going to be having to putting several thousand in marketing a month that he's not doing now. He may see that as, okay, my income's dropping that amount every month if I do that, without looking at the long-term benefit. So that's something, we coach through to get him there.
And then, we're talking about, let's be clear here. So we talked a lot about Google reviews in part 1. We'll talk about it more in part 2. Just for a record, he's owned this practice for 3 years. He has 29 reviews. So, there's a lot of improvement to be had in that area. And that's something that'll be touched on even more next week. But I think that if you go back to the idea of the fourth day, I love the way Suzanne talked him through that, because when you look at it, I think this is an area that I have a big issue with is, when you look at, and this is actually coming up on the webinar, where you look at the revenue from a hygiene appointment. There are 3 sources of revenue. It's not just the hygiene production like everyone thinks. It's the hygiene production. You also get exam production for going in there and saying hi to the patient, you get paid. Mm-hmm. And then you also accept treatment. And with his photography and his comprehensive dentistry, the amount of treatment that he's accepting per exam is likely very high. And so for him, the break-even point on adding that hygiene day is really low. It doesn't have to be maybe 1 patient and it pays for the whole thing. And I think that's a concept that he clearly doesn't understand. And most people don't, but it makes so much sense in the situation to open up that fourth day because he wants it. He wants to work the extra day. He has a small team. And then I think at that point, he only has 3 chairs. So adding a second hygienist and taking away a doctor chair, even though he says he only uses 1, I don't love that idea initially.
Yeah, and also talk about the intangible benefits of having a new patient, right? Because who's more likely to leave a Google review? A new patient. Yeah. Who's more likely to refer a friend? A new patient. This is what I've seen in my practice the last 3 years. I get most of my reviews from new patients now. And and added into all of the actual financial benefits you just
Yeah.
touched on, that they pay
Well,
for
and he
this.
can't book new patients right now because he's booked out too far.
Right. And that's an issue.
Yeah.
Big time.
Big issue. Yeah. So Matt, I wanted to touch on, so you and I have both worked, he's currently in a 3-day schedule, and this doesn't come up very often, but I pointed it out because I remember when we had first started working together, I was working Tuesday through Thursday.
Mm-hmm.
And I remember you and I were having the conversation of, I think you never actually went to 3 days, but you were talking about going to 3 days, and you were going to go Monday through Wednesday.
Yeah.
And in that conversation, you convinced me to go Monday through Wednesday. So can you talk about the difference between a Tuesday through Thursday and a Monday through Wednesday schedule?
Yeah, I mean, I used to be closed Monday for a little while, and since I added it back, it's always my busiest day, without fail, always. And my least busy day is always my last day of the week. So it used to be Friday, and now it's Thursday.
Yeah.
So I very much believe a dentist being open on Mondays. I think people have emergencies over the weekend, and I don't know, start of the week, whatever the psychology involved in this, I'm not sure, but that's always been my busiest. I would never leave that day open if I was a dentist.
Yeah. So it was funny. I used to golf every Monday morning, and I wasn't super, my practice was struggling at the time, and I really was having a hard time mentally. And I would golf every Monday morning, and it was like my only good thing about my practice was that I wouldn't go in on Monday. And I emotionally relied on that golf round every Monday morning. Like while everyone else was going into the office, I was golfing, and it was like, okay. And then I go Tuesday, Thursday, and go deal with the things I'm not enjoying. But the reality is Monday is so many emergencies, broken teeth, all of these things, being there on that day. And patients prefer, I don't know why patients prefer bigger restorative appointments on a Monday. It doesn't make sense to me because you got the whole week where you're uncomfortable.
Yeah.
I would choose a Friday if I was a patient, but for whatever reason, people prefer Monday. And so, when I saw that, I was like, oh, that's interesting. Well, we're going to talk about opening a fourth day anyway, but at the same time, I'm pretty, I think that a Tuesday through Thursday is like you're picking the worst days of the week as your 3. I'd say best day of the week is Monday. Second best day of the week, would you say Friday?
No, I mean my best days aside from Mondays are always my late day. So that's Tuesday.
Oh,
so
Tuesday.
I feel like the day of the week doesn't matter, but whenever I have an opening till 7, that's the busiest day.
Yeah, I know Monday's a big restorative day. I think that's pretty ubiquitous across practices.
What did you think of his approach of bringing on, I guess, call her a manager who had no dental experience and giving her a lot of leeway to implement things? He seems very empowering of this person.
I was impressed that was the one thing about him that didn't feel very solo. Was that level of empowerment and delegation, which I mean he seems very good at getting things done in his business that are needed to be done. He's operationally, he seems very disciplined. He seems like he can stay focused on tasks and implement things. I definitely saw that from his tone. And so I think it's cool that he had a manager who he's even further, that's what I love about, when you get this guy as a coaching client, he'll actually do the things that you tell them to do. And that you'll get the results because he has that implementation in place already. And then, working with his office manager, you can even help her even more and kind of pick up the dental side. So yeah, it's nice when they have that type of infrastructure in place. You can go a lot faster.
And I like to commend him too for being very open to feedback and unattached from when Suzanne pointed out a weak area. No negative reaction, no excuses. Very, very refreshing to see him really coming here for general input and not being attached to how it looked and getting defensive or anything like that. So that was cool to see.
Yeah, and I like that he, like you said, we get defensive people a lot, but I don't think he wasn't defensive at all.
No. And another thing I found interesting that Suzanne brought up that is not actually something I ever think about is what type of patient he wants to attract to his office. She pointed to his website, which has these 8 pictures of these very attractive young people as their stock images for their different subjects of his website. Yeah. And she really pointed to him that, hey, you're actually more looking for the kind of more middle-aged, someone needs more complex dentistry, who's going to be with your practice a lot, rather than the transient college students he sees sometimes. So I thought that was interesting. I never think of that. I guess that's branding, your favorite word.
Yeah, my absolute favorite subject. Yeah, and it's so I want to go back to that concept though. So Matt, this is something we've come up with a lot, where we have dentists and I feel like it's, I don't know, at least I say it publicly, where it's the first thing to learn is surgical extractions, then endo, then implants, then Invisalign. I kind of rank the specialties and like the things in order of operations, but I think demographics for your specific patient base have a lot to do with where you should go clinically.
Mm-hmm.
And on the surface, I think a concern I have is Suzanne, he had talked about, it's like, I want to do all these big comprehensive cases. And it's like 1.6% of his production, like at the moment, and my concern is maybe his patient base doesn't want that type of dentistry. Maybe there's another niche that he could go down that he still enjoys that is more favorable for his practice. Like for me, Invisalign is a big part of our office now because we're younger and our patients, they have that need. They don't have the need for full mouth rehab and a ton of implants and stuff like that, like they might in a larger or in a practice of my size in an older demographic. And so what do you think about that concept of like, because I know that in coaching, right, there's a lot of conversation about what specialty procedures you add to your practice. What do you think about that way of making a decision versus kind of the dentist's just pure clinical interest?
Yeah, I mean, that's definitely an area we delve into in coaching is, especially someone who's been an owner for a little while. Hey, like, what do you seeing your patients need? What are you referring out a lot of the times? What are they asking you about? And kind of taking your CE to match the needs. But part of me also feels that like when you have the skills, the opportunities present themselves. Like, my patient base is older, but when I had the Invisalign, when I had the iTero, my cases jumped up a ton. So like, I think it's kind of a both and in that regard. It's, if you do have the skills, if you are interested in it, if you like talking about it, if you like playing around with the technology involved in the procedure, that the opportunities will present itself because you're looking for them. So I think.
But doesn't he already know how to do these procedures?
Yeah, he does.
And he has taken a bunch of photos. Like, what else is he going to do more of these?
I think so. I think it's more about the implementation of it, and maybe that's being lost somewhere. Like the fact that he's not doing enough. I would tend to think that it's more about his approach versus actually what the patients are needing or like wanting.
Yeah, it could be, right? And I think, like I said, it's a both and. He already has the skill, so it's not like he's going to put that down. But I think that for him, if he's very clinical interested, like he seems like he is, I would really look at, okay, where's the next area I'm going to explore? And I would try to look at something that my patient demographic wants, and make it a big part of the practice personally.
I cannot relate to the photography part of this. There's little in dentistry I have distaste more than getting out a DSLR and taking a picture. That sounds awful.
So I've seen it from both ways. I mean, the actual process of doing it, I think is cumbersome, but showing the patient pictures on like an iPad or something like that, where they can zoom in and see it, like if you really want to treat comprehensively, I really see the validity of it. Definitely. And I mean, it's like the iTero, I think, gives you some of that too, which I've seen the benefits of the iTero in that same way, like night guards, cracked amalgams, all of those things. But at the same time, the process of actually taking photos myself.
How about the process of buying a 3-op practice?
Yeah, so let's talk about the 3-op practice because I wanted to touch on this. I had a hard time gathering. Is there a 4th op available or no?
He has right of refusal on the space adjacent to it, so I think he can expand when he needs to.
Okay, so what the game plan I would think on the surface would be: you grow your 4 days a week that you want to work, you fill them all up with one hygienist, and then I would say on 2 of those days you add a second hygienist. But the hard part is, see, this is where he's not going to like it, because usually if you're down to 1 op restoratively, that means you're going to be more busy doing exams because you have 2 hygienists, but he might be wanting to do his big cases on those days. So he might not be a fit for the slower, if he can ramp up the slower model and maximize 1 hygienist, he might not be a fit as a dentist for a 2 hygienist model because it might be too many exams to interrupt him from his big cases.
Right.
So I would use the gauge of, am I doing enough dentistry with 1 hygienist to the point where my schedule is very full and I can't do anything more restoratively and I don't want to become more efficient? Then I would stay with 1 hygienist long-term, 4 days a week. But if you're like, well, I want to grow the practice. I mean, because he said he wants to do $1 million. And if he's doing 3 hygiene days a week right now, I'm not seeing how by adding 1 more hygiene day, he's going to push himself over $1 million. I think he would need the second hygienist part-time.
Yeah, definitely. I mean, unless he had a big jump in the complex treatment he's doing, which would be a pretty sizable jump, he would not get there without that.
I think he would need that second. I think he would need the second hygienist 2 days at least. to get him over the million, which would kind of conflict a little bit with the photography thing. If I mean, I don't know like his new patient process and all that stuff, but like just the feel of a slower practice, it's going to push him a little bit. I think. I mean, do you remember the transition from checking for one hygienist to checking for two?
I don't
Remember you were complaining about it a little bit.
Yeah, I think I was at the beginning. It was probably a couple months of an adjustment time of like
Yeah.
this feels like a lot. It didn't last much longer than that though.
Yeah, it's a very typical when the solo dentist transitions from one hygienist to two hygienists, they notice that initial like 2 to 3 month period of like this is a lot of exams because it's twice as many. Like it's already annoying enough when the hygienist comes to get you. Now they're getting you twice as often. Like
Right.
it's very palpable.
Well, I think the breakdown was really in the training of the hygienist that not enough was teed up at the time that I was doing the exams. Like now it's obviously no big deal. And I would think my 2 exams are probably the same amount of time my 1 exam took, a couple of years ago.
And this practice is the perfect practice for that type of like team-led diagnostic and communication, because if there's photography and a lot of stuff, it's a lot of diagnostic and patient education. And so, really having the team lead that discussion and be trained well enough to do that would be, and that's how I would do it. I wouldn't be having all these conversations myself with the patient. That's for sure.
Yeah. And he's in the right demographics, and I know his area, and it's a wealthier area, and he has lower insurance involvement. So
is his patient base younger or older? Do you know the demographics that well?
I would imagine they'd be older. Yeah.
Okay, so they are the good fit then for this model.
He said he's right around a big college school.
I would definitely add implants if I was him. Is he placing implants already? Did he say? I forgot. Okay.
Yeah. But yeah, his patient base is ripe for this. So I like that he's like trying to push it in that area.
Totally. Yep. All right. And so for part 2, I just kind of want to give a little bit of a preview, and maybe I'll repeat it in the intro for next week. But now Suzanne, so in part 2, the way we typically do it is part 1 of the show is we really talk to the guests about their vision, their goals, kind of things keeping them away. It's like the diagnostic episode where we're really getting information. And then part 2 is when we go through their data and we sort of see their opportunities for growth. And so that's what we're going to talk about in part 2. And again, we're trying to go from like that 500-ish K office to like the million. And the way of doing that is we need to add the 4th hygiene day, like we talked about in the episode. And then we need to, Matt and I think eventually there might be a need for a second hygienist, which he had kind of talked about a little bit in the episode. But it's really a new patient flow thing. So for him, and then in the second part, we'll talk about his retention, which also is an opportunity. So Matt, do you have anything you want to add to part 1 before we wrap up?
No, I just like the name Eddie. I feel like you got a buddy named Eddie. He's always like this funny guy, usually like maybe a little overweight.
It was his fake name, right?
Yeah.
Because I've been saying it the whole time. Okay.
Yeah.
I mean, at this point, it's just real doc and name. I don't think we say fake name anymore.
I agree though. Eddie's like, oh, that's my funny friend Eddie. Like,
it reminds me of the goofy guy from if you watch Friends, there was that crazy roommate Eddie. That's what I'm thinking of right now.
Yeah.
There we go. All right. We hope you guys enjoyed the episode, and we'll see you guys next week. Another episode of Practice Underwater for part 2 with Eddie, our goofy doc.